Hi there, welcome to Health Diary. My name is Winnie Lubembe, and today on the show, we'll be focusing on one of the things that we do every second of every day, and sometimes without thinking about it. I am talking about breathing. But for millions of people, and especially those ones who live with chronic lung conditions like, for example, asthma or chronic obstructive pulmonary disease, or post TB complications, and as well as post COVID complications, to them, breathing might feel like a heavy task. So, the question that we'll be seeking to answer today is on pulmonary rehabilitation, and we'll be understanding who needs it, what exactly is it, and why is it very important. But we start with the facts of the matter. Chronic obstructive pulmonary disease is the fourth leading cause of death worldwide, causing 3.5 million deaths in 2021, approximately 5% of all global deaths. Among the treatment options is pulmonary rehabilitation, a program combining exercise, education, and support to manage chronic lung diseases like chronic obstructive pulmonary disease, pulmonary fibrosis, and bronchiectasis. All right, let's talk about pulmonary rehabilitation. And to help us with this part of the conversation, we have Eric Oma, who's a respiratory physiotherapist from Vista Services. Good to have you on the show, Eric.
Thank you very
for
much.
making the time. So for the purposes of someone who's just tuning in today for the first time, and they're like, what exactly is that? I have never heard anything as far as pulmonary rehabilitation is concerned. What is it?
Yeah, it's very new in Kenya. However, it's something that has been happening in developed world or in other parts of the world. So pulmonary rehabilitation is a special rehabilitation for patients suffering from chronic respiratory diseases, especially COPD, post-TB disease, patients with asthma, interstitial lung disease, and also to some extent, cancer patients. They can also benefit from pulmonary rehabilitation. Yes.
Okay. So can we talk about what's normal and what's not normal? Especially when you're talking about our respiratory, what is it called? I want to say system.
Yeah, respiratory system.
Yes.
Yeah, so the normal respiratory system, you see your lungs are made to breathe. So to exchange air, that is oxygen and carbon dioxide. To get carbon dioxide outside the body and also to get oxygen in the body. But sometimes people get a problem with their lungs where they find that now the lungs are not able to exchange carbon dioxide and oxygen properly. So then the oxygen levels become low in their body and carbon dioxide rises in their body. So that's in that case we are talking about COPD patients. But also there are other patients like patients suffering from what we call interstitial lung disease, where you have that the lungs now they have fibrosis in the lung tissues in the alveoli. So that also impairs the exchange of gases. So then that with that impairment now, you find that one of the presentation is the weakness of the lower limbs, especially the thigh muscles become weak. What we call the quadriceps muscles, they become weak. So such patients, they need a special rehabilitation. One, to improve the oxygen consumption in their body, but also two, to strengthen their body so that they are able to do their daily activities. Because you find most of the time these patients, they are not able to do their daily activities because one of the things that is prominent in them is what we call dyspnea or shortness of breath. Even with walking, they become short of breath. Yeah. So then we need to rehabilitate them to improve their shortness of breath. And that shortness of breath sometimes is just perception. Because sometimes you find that you feel short of breath, but actually you have enough oxygen in your body. Yes.
Okay. You know what? I'm still thinking about the thigh muscles and they're weak with the respiratory system.
Yes. So the link is, you see, your body, the body cells, the tissues in your muscles need oxygen to metabolize or to break down food into energy that now gives it energy for someone to walk. So now in a situation where there is little oxygen, then you find that the body cannot produce enough energy that can sustain movement. So now the link is that if your lungs are not able to exchange oxygen and carbon dioxide properly, then the oxygen levels in the body goes down. So when it goes down, it means that the body cannot produce enough energy for movement. One of the most affected muscles is the muscle, the thigh muscles.
muscle.
Because you know you need your thigh muscles to move around. You need to sit and stand. You need to use your thigh muscles a lot. And even in movement, when you're walking, running, jogging, and everything, you need your thigh muscles. So they're very important. And they're the most affected when someone is having these chronic respiratory diseases.
Interesting.
Yes.
Okay. So then how do I know that my lungs are compromised? Because I want to believe probably by the time someone gets to that level, they would have had to go to the hospital and then they're being referred to you. But for the purpose of probably someone who does not know that there's something wrong with their lungs.
So there are classical signs for lung impairment. One of them is shortness of breath. So you find that when you stand up, you start walking a few steps, you feel like you are short of breath. Like you walk around 100 yards or 90 meters, then you feel like you are short of breath. There is also shortness of breath with the exertion. So exertion is doing an activity. So when you start doing an activity, like let's say for example, house chores or the activities that you normally do, you find that now you start getting short of breath. Then you know that your lungs are impaired. The other things that can also show you that your lungs are impaired is how you breathe. So if you are struggling to breathe, you feel like when you are breathing, you are struggling, the air is not getting in properly, and sometimes you wheeze, especially in the morning or in the evening, or when there is change of weather, then you know that your lungs are impaired.
Okay.
Yes.
And for children, is the presentation the same?
Yeah, presentation is similar to the children. However, children will notice with the wheezing. So wheezing is more prominent in children than in adult. Because you find and also exertion. So you find that if your child has lung impairment, now they're not able to play like the children of their age. So then you know, oh, there's a problem here. And then you see they're now trying to gasp for air. And also their respiratory rate goes high. Then you know, oh, their breathing rate goes high, they breathe severally in a minute, then you know, oh, there must be a problem here with the lungs of my child. Yes.
Okay. So when we're talking about pulmonary rehabilitation, can we then understand how that improves the quality of life? And are there other medications that, accompany the rehabilitation?
Yes. So pulmonary rehabilitation is basically, it is divided into two. So we have exercise part and education part. So education part helps you in understanding the disease that you are suffering from, knowing the triggers, what triggers the inflammation, or triggers what we call exacerbation, where now you feel like short of breath and everything, but also how to live well with your condition. Now, in terms of exercise, we do two types. So there's an exercise for strengthening your muscles of the body, but also there's an exercise for your lungs, to help improve your lungs, to make sure that your lungs now work better. But also, I know this is something that's not normally done, but you find that if for example, if I was to do what we call venous blood gas on you, there is a good amount of oxygen rotating in the body, doing nothing. So the pulmonary rehabilitation help you now to utilize that oxygen. So your lung volume remains the same, but now your oxygen utilization goes high. So that oxygen that rotates around your body doing nothing now becomes active. And when that happens, even shortness of breath now goes down. So you're not feeling short of breath because now the brain interprets that there is not enough oxygen in the body. So then it reduces your breathing drive. Yes.
I'm just thinking about obesity or some form of allergies, and is there a link to probably
obesity? This what we call obesity hypoventilation because of increased weight on the chest. So the chest is not able to expand and contract easily. So obesity can cause hypoventilation. So but obesity, one thing that we advise our patients is just we put them on weight management strategies to reduce their weight, and then the problem is resolved.
Oh wow!
Yeah,
okay.
Yeah.
It
sounds
easy, but
it's simple.
Okay, and some types of allergies as well, because I've seen people also struggle, and especially when it comes to wheezing and whatnot at specific seasons.
Yeah. So allergies. The different types of allergies. But then allergies, the first thing we do, for a patient coming for pulmonary rehabilitation, the first thing we normally check is to make sure that they are optimized in their medication first. Okay. Then now we accept them in pulmonary rehabilitation. Yes, so we make sure if they have allergy like rhinitis and the rest, we make sure that that is sorted out first before they come for pulmonary rehabilitation.
Okay.
Yes.
All right. And looking at sleep apnea as well, can you just talk a little bit about it and how?
Yeah, so you find that now the patients with lung impairment, some of them present with difficulties sleeping. So when somebody goes to sleep, they feel they can wake up feeling that they're being choked in the middle of the night, or they are waken up by a cough. And sometimes also in the morning when they wake up, they feel like they have a little bit they have a little bit of headache, their level of consciousness is low and everything. Then that can prompt an investigation of a sleep, where we now do a sleep apnea to see how you are sleeping. So sleep apnea is basically cessation, or you stop breathing when you go to sleep, when you're in deep sleep. That is sleep apnea. And then we have two types. So we have obstructive sleep apnea, and we have central sleep apnea. So we do the test to distinguish which one that somebody presents with. So obstructive is just basically when you sleep, when you breathe in, when you're sleeping, your upper airway collapses, so you're not able to breathe out. So somebody wakes up feeling that they're being choked, or they wake up with a cough, because now it triggers the brain. When you stop breathing, it triggers the brain that actually there's no breathing happening here. We need the person to be conscious so that they can breathe. So then you wake up with a cough, or sometimes you find yourself waking up feeling like somebody's choking you. Those, yes. And then for the central is now because you see the sleep is controlled by the brain. So sometimes you find that you have brain impairment that is now affecting the areas of the sleep, so that you are not able to regulate your breathing. So when you go to sleep, because you are unconscious, the brain activity also disappears. So then you are not breathing when you go to sleep. So we have those two types. So then based on the presentation, there are management that you can do.
Yeah.
Yes.
Okay, we'll talk about management in just a second, but also for cancers, because you mentioned, some types of cancers might predispose someone to, issues with the lungs that then they might need rehabilitation. So do we know what types of cancers and how rehabilitation also comes about?
The lung cancers, that is the one that we are interested in. And when somebody comes for this pulmonary rehabilitation, we normally look at what we call MRC score, so medical research questionnaire score, to see your scores. So a score of, so the scores ranges between 1 to 5. So we normally take a score from 2 to 5.
We've seen, and especially after COVID, because we've talked about diseases, conditions, lifestyle, obesity being one of them, but also during COVID, we saw a lot of post-COVID complications. So are there other illnesses that might present with post-complications,
Yes.
especially when it comes to lungs being compromised?
Yes. So like COVID, there is what we call long COVID syndrome. So long COVID syndrome presents similar to these respiratory diseases. In fact, most of the time it is confused with somebody diagnosing a patient with, this is COPD, or this is interstitial lung disease, or the rest. But actually it's just a long COVID syndrome. So because you see, the research is still ongoing on COVID, but there is this condition called long COVID, where you find that now your lungs are impaired, your breathing changes, and that long COVID also brings what we call dysfunctional breathing, where now you are not breathing at the normal rate, you are not taking enough volume, because basically when you are breathing, you are supposed to take about 500 milliliter of oxygen or air into your lungs, and the same out of your lungs.
Children as well. I'm just thinking about, say, like premature babies, and I'm asking this because we had a conversation about premature babies and their lungs probably are not fully
developed.
Fully developed and whatnot.
Fully
so
opened,
are they at risk of some of these diseases, conditions?
Yeah, so you find that when someone is born preterm, they normally, when they grow up and they reach 40s and 50s, they develop these lung conditions just because of they were born preterm.
Yeah.
So because you see, when you are born, your lungs are supposed to have matured enough to sustain breathing outside the body. Or outside the womb, all right? So if your lungs have not matured enough, then you will have difficulties when you grow old. At some point, it will catch up with you.
So we're due for a break, but when we come back, we'd want to understand do all these conditions that we've mentioned, and probably others that we'll talk about after, do all of them require medication? Do all of them require rehabilitation? Because we talked about two different forms of rehabilitation. And then we also have equipment here, which he will show us as well how that works. So there's so much to come on the other side. Do stay with us. Welcome back to the show, and just in case you're tuning in right now, today on Health Diary we're discussing pulmonary rehabilitation and just looking at the different conditions and illnesses that might necessitate or require someone to go for pulmonary rehabilitation. And we have Eric Oma, who's a respiratory physiotherapist from Vista Services, joining us for this important conversation. And Eric, just in case someone is tuning in right now, probably they've missed out on the warning signs as far as a serious respiratory decline is concerned. What are some of those things we can go through?
Yeah, so we said that one of the signs is shortness of breath. So you feel short of breath with even just walking. Sometimes you feel short of breath with exertion. So exertion is when now you start doing an activity that you normally used to do. Now you start feeling short of breath. Or sometimes when it is too bad, you even feel short of breath with dressing and undressing yourself. Then you know that, oh, this is lung impairment. But of course, the other things are like you wheeze, you feel like you wheeze, you feel like your chest is tight, you're not able to take in enough breath. Then you know you have a problem with your lungs, so you need to be checked.
Yeah.
Yes.
And when you're talking about walking, how far?
Walking can be as little as around 90 meters. You feel short of breath. Yes.
Okay. And it doesn't matter whether you normally exercise or not.
Yes.
As long as it's just.
Yes. So you can even find that when you are walking, just a normal walk, a brisk walk, you feel short of breath after about 90 meters. Then you know, oh, there must be a problem with my lungs.
And we also talked about rehabilitation again being part of, I want to say, a treatment course.
Yes.
But are there medications before we look at some of the equipment?
Yes. So we normally say, because you see, for these lung conditions, somebody needs to be on medications. So if it is COPD, you're supposed to be on your inhalers. You're supposed to be on the other medications that helps you to open your lungs. And of course, if it is the other lung conditions like interstitial lung disease, then you need to be on the proper treatment for that as well. And of course, if a patient has interstitial lung disease, apart from this medication that they see, we also normally send them to a rheumatologist to look at what we call connective tissue disease. Because of interstitial disease, sometimes they present with connective tissue disease as a result of rheumatoid arthritis.
Okay.
Yes.
All right. And then when it comes to rehabilitation, so you talked about the two different types. There's the educational part, and then there's that?
The exercise part.
The exercise part. Okay. For educational, I know you mentioned a little bit, but can we just go deeper into understanding how does that look like, and for how long, and who are the people who need to understand, the different...
So education part covers almost everything to do with the lung condition, but it is specific to what somebody is suffering from. All right, so it covers on how to live with your condition safely at home, how to recognize signs of what we call exacerbation, or you're going to have attack. And sometimes it also covers travel. When you want to travel, how can you travel safely with your lung condition without having any challenges?
And does it also cover support? Because I want to believe
yes,
other family members should also be incorporated.
Yes, so there is also a little bit of psychological support, but also if somebody has been smoking, we also have smoking cessation support and those education part of it. But we also teach the members of the family of the patient how to recognize signs and how also to understand the disease itself, because sometimes a relative is suffering from a disease that you don't understand, and there may be some expectations to you on them, things you want them to do and they are not able to do, and you're wondering why. So we also teach the family members to understand this condition that the patient is suffering from and how to support the patient.
Yeah,
yes.
Or probably use other methods that were used several years ago.
Exactly.
Which might not necessarily help the person. Okay, and then when it comes to the exercise part of it, what exactly does that entail?
So what we do, there's what we call initial assessment. So initial assessment, we look at the impairment that you have, the difficulties. We also scale you on MRC score from 2 to 5. We look at where you are, where you belong. And then once we do that, we now design for you a specific program specifically for you to address your needs and concerns. Because the other thing that we also do, we check what do you want to achieve, yes, as an individual. What part of your daily activities you want to improve. So then when we are designing the exercise, we make sure that we capture that to make sure that you get what you want, not what we think is best for you.
Best for you.
Yes.
So we have two, but you have a lot of things happening here. So can we understand what works best where, what is needed where, and who needs what? Yes,
so as part of rehabilitation, we normally assess for especially the patients who are a little bit sick. We normally look at when we go and see them in terms of respiratory care, we look at how easy can they cough, and are they able to generate enough pressure in their stomach to remove the mucus in their airway, all right? So if you find, for example, a patient with neuromuscular disease who has a weak cough, we support them to get rid of the mucus in their lungs. So we use this is called cough assist machine. So this machine helps you to get rid of the mucus in your lungs, but it is non-invasive. So we are not going into your throat or anything. It's just a mask that we put on your face, and then we set the machine based on the patient presentation, and then the machine will help you to get those mucus that are stuck in your lower lung areas to the upper airway where we can now get them out. If somebody has what we call atelectasis or collapsed lungs, this machine can also help you to inflate those collapsed alveoli. So it does mean both mucus removal and also to open the collapsed alveoli. And it is safe. It can be used in both patients that are intubated in the ICU and also the patients that are walking around or the patients that are bedridden. So it can be used in all population yes, of the patients.
To see how that works in terms of helping clear the mucus in the lungs.
Yes.
Because you said it's non-invasive.
Yes.
So you put a mask, right?
Yes, yes.
Are there like...
So this one, so it, yes, so this one will help you.
Yeah.
One, it will give you a breath in, then give you a breath out. So in between breath in and breath out, it does small coughs in between to help you. So when it gets breath out, then it sucks that mucus out of your lungs. Yes, that's how it works.
Okay.
Yeah.
Right.
I have about 3 gadgets here actually.
Okay.
So you find, this is specifically for patients suffering from COPD, chronic obstructive pulmonary disease. Sometimes you find that they are given this insatiable spirometer to use at home. However, patients with chronic obstructive pulmonary disease or COPD, their biggest problem is getting air out. So they have what we call breath stacking, where they breathe in. Now what this does is to help you breathe in. It doesn't help you to breathe out. So it means that already the alveoli of these patients is already to the maximum, but we are still encouraging them to breathe in. So meaning that we are making it even worse. So it is not safe for them to use this. Instead, this what we call the PEP device or the OPEP device, like for example this aerobica. So this one is encouraging patients to breathe out. All right. So then they can get that excess air out of their lungs. Yeah. But also it has, if you look here, it has resistance. So we can try to resist your breathing out. And what that does, it helps you to strengthen the respiratory muscles if they were weak, especially after ICU admission, where you are put on the machines and the machines were breathing for you. So you find that your diaphragm, the main muscle for breathing, becomes impaired. So this helps you to strengthen your respiratory muscles, especially the diaphragm and the rest, so that you are able to breathe nicely. If someone is not able to afford, because this is a little bit expensive, is not able to afford this aerobica, we have alternative. So alternative is what we call the mucus removal, this gadget. It does the same thing. It has a ball here. So it normally comes with 3 balls. So depending with your respiratory muscle strength, we can give the medium ball, there's a big ball and the small one. So then we give you this one, you breathe through it, and it vibrates as well to help you get the excess air out, get get the mucus out,
Yeah.
and also strengthen your respiratory muscles.
Okay.
Yes.
Like both of them do a bit of like strength training.
Yes, strength training, and also to get
muscle.
the excess air out, because for the COPD patients, their biggest problem is getting air out. They don't have problem getting air in, and that is what we need to encourage.
I'm just curious about this for a second, because I think during COVID we saw a lot of people actually using it. But then again, so this is what I'm saying, right? It's like 600 cc's, 900 cc's, 1200 cc's per second. And we were discussing this before we came on air, and we said sometimes there's some people who don't know how to use this, because we just think it's just blow and then the balls go up and whatnot.
Yeah, it is incentive parameter. So what you do, you blow in, the balls rise, but for it to benefit you, you have to blow in and then sustain that blow so that the balls are up here without falling down. That is when it's going to benefit you. But if you just do a blowing in and out, doesn't help. For the patients with rib fractures, they will need this. The patients who have undergone a surgery on their either abdomen or their chest, they will need this to help to expand their lungs. So this is indicated for them. But for the COPD patients, and also to an extent, patients with bronchiectasis, because with bronchiectasis you see this increased production of mucus, then these two will be able to help rather than giving them this.
I see.
Yes, yes.
And then there's one here.
Yes. So this is what we called a spacer. So when a patient is using an inhaler, they're supposed to be given a spacer as well, because when you use inhaler and you put it, the meter dose inhaler, we put it in the mouth and just press, all that medication, a lot of it gets stuck in your mouth. All right. To help that medication reach your lungs, because that is why it is needed, you need a spacer with you. Okay. So you put the medication here, you put it in the nose and the mouth, you blow. You puff and then you blow in. So that medication goes straight into your lungs rather than getting deposited in your mouth. Okay. Yes.
And then we have another machine here.
Yes, so this is called, it can work both ways as a CPAP and a BiPAP machine. So this is for the patients, either patients with neuromuscular disease that are not able to breathe on their own. So we need this machine to help them breathe, all right? But also for the COPD patients that are not able that are retaining carbon dioxide in their lungs, we need that, what we call carbon dioxide washout, where we now use this machine to get rid of carbon dioxide. And by the way, if your carbon dioxide goes high, you'll definitely end up being admitted in the ICU.
So how does it? How exactly is it? Because
so it has a portable, artificial lung here. The other thing, maybe before we go to the artificial lung, also the patients with sleep apnea, we also give them this to help them breathe better at night. So this breathes for you at night when you sleep. So then you don't have problems, or you don't wake up feeling like somebody's choking you and everything. So it stops you from having trouble sleeping. So I've already set this. I preset this. I just need to switch. Oh, it's off. All right. So already set everything. So once we've set everything and the machine is working, what the patient needs is only to press that button, and it will. So you press and hold, and it starts breathing for you. Yes, but also because this is, as you can see. But also because this is artificial lung, if it is for the human beings, we also set sensors. So when you put the mask on, the machine automatically starts breathing for you. When you remove it out, it stops. So you don't even need to touch the machine. Yes. Yeah, because sometimes you're in deep sleep. Exactly. So the machine will do it for you. So long as the mask is on, breathe for you. When you remove the masks, it stops breathing for you. But of course, it will alarm when you remove the mask and tells you there's a leakage or there is mask disconnection or the patient is disconnected from the machine. But then you just need to stop it. And we always show the patient how to use it. So then they are not in distress and everything. Yes.
So then as we bring this to a close, what is that one thing, or either just one myth, that you'd like to debunk really as far as our lungs, breathing, lung health in general is concerned?
Maybe one thing that I would say, when people see you with a machine like this at home, they know that you are dying. They just count days for you. But what I can say, people can live with this as many as 40 40, 50 years. It's just to support you breathe better at night when you sleep. So somebody should not be scared to get one of these machines to support you at home.
I see.
Yes.
Eric, thank you so much for coming by today. Eric Omar is a respiratory physiotherapist from Vista Services, helping us understand pulmonary rehabilitation. We've come to the end of our discussion today on pulmonary rehabilitation, and I'm sure that you've gained a lot of insights from the conversation today. And the next time you think about telling someone, well, just take a deep breath, we'll probably try and understand, is breathing easy for them? My name is Winnie Lubembe, and if you have any other question as far as the topic of discussion today, feel free to engage with us on our digital platforms at the bottom of your screens. But for now, enjoy the rest of your Sunday and the rest of the week. I'll see you next week. Adios.